I thank the gentleman for the time. I want to begin by acknowledging what my good friend from Kentucky said. Last year we did do something in a very good way in a bipartisan sense. We spent $500 million on this problem in grants around the country. We also passed in the Cures Bill major mental health overhaul. And this year, frankly, the President's included an additional $500 million. So I think this is a problem, honestly, that we all recognize exists and that we're all willing to do something about. But when I listen to the debate today, and it's been a good debate. It's been one that I think both sides have made sincere and detailed points on. I look at it maybe a little bit differently from some of our newer members because I was here the last time we went through this debate. I was a member of Congress when Obamacare was enacted. And we were told at that time that if we passed it, costs would go lower. They haven't. We were told that we would have more choices. We don't. And we were told that if you liked your doctor and you liked your plan, you could keep them. Well, the reality is, for many people, that just wasn't the truth. In my home state, we are in a crisis situation in the Obamacare. We have our rates are going up 69% next year for those that pay the full rates, and we're down to a single provider for an entire state. That doesn't sound like a successful system to me. When I look at the American Health Care Act, I see several things. First, it doesn't, frankly, damage the three essential pillars of our health care system, which are first, employer-based health care. That's where most Americans get it. If anything, it pushes back this onerous Cadillac tax for 8 years, something that I think we need to get rid of altogether. We should never be taxing people for their health care plans. Second, it keeps the basic Medicaid functions intact, and it keeps Medicare for older seniors, although I agree with many of the comments made today, both these systems are very much in need of reform. And the bill also provides a transition period for people that are actually currently getting health care through Medicaid expansion or some other form of Obamacare. The Act does a number of things, which I think we ought to talk a little bit more about what it does. First of all, it's not required. If you don't want to participate in it, you don't have to participate in it. That's a big change from Obamacare. The second, it provides direct help to individuals in the form of tax credits, refundable tax credits, so you can pick what you think is best for you. And that, to me, is the hallmark of any good health care system. Finally, over time, it lowers the cost of premium, and again, over time, it lowers the deficit of the country. Not a bad thing. So I think we ought to leave a failing system, quite frankly, and move toward a system that promises to do better than what we're doing today. I would also suggest this product isn't finalized. It's going to change during the course of the legislative process. It'll change in the House. It'll certainly change in the Senate. Staying where we're at is exactly the wrong thing to do. With that, I want to yield 3 minutes to my good friend from New York, Mr. Faso.